My name's Gunn and I'm an interventional cardiologist based in Sheffield, England. I'd like to show you a case in which the MGuard mesh-covered stent got us out of a very tricky situation in a gentleman who presented with a primary angioplasty for an anterior ST elevation myocardial infarction and a very heavy thrombus load. So this is the left coronary angiogram of our patient who's 73 with an acute STEMI. You can see his LADs completely occluded. There's also a filling defect representing a massive thrombus burden in the LAD. This is an image of the left coronary in the spider projection, and you can see that the thrombus is indeed occluding the proximal LAD. Normal practice for a patient with extensive thrombus is thrombectomy, and this is indeed being shown here. This shows that the thrombectomy catheter has indeed extracted some thrombus, and despite that there is a massive thrombus load in the proximal LAD just where a large diagonal artery comes off. More thrombectomy. For these cases, multiple extractions are often necessary. So after multiple episodes of thrombectomy, we are still left with a massive thrombus burden exactly opposite the takeoff of a large diagonal branch. When we look at that in the RAO caudal projection, run 13, we can see that the thrombus is still present and quite rubbery inconsistency. You'll also notice that the flow is somewhat reduced distally. And what was characteristic with this patient is that after a few minutes, flow would then stop completely. This is a very interesting angiogram because you can see the anatomy of the artery, the thrombus, and where the diagonal branch emerges. So the question was what to do in this situation where thrombectomy has been performed multiple times and a 2B3A inhibitor has also been given. And the answer could be the MGuard. The MGuard is a stent with a mesh on its surface designed to trap thrombus. The problem is it's not normally recommended to be inserted across a branch, but in this case I felt I had no option other than doing that. So I took an MGuard 4mm in diameter and 24mm in length and positioned it in the LAD. So in this spider projection you can see that we've positioned the MGuard stent across the origin of this large diagonal branch, but the proximal end is clear of the circumflex. Inflation of the 4mm MGuard in the proximal LAD. You can see some dye trapping in the large diagonal. This looked small, so we inflated the balloon to fairly high pressure, and run 19 shows a very gratifying result immediately after MGuard implantation, with TIMI grade 3 flow down the LAD and good flow, almost TIMI grade 3, in the branch. As the proximal vessel was very large, we took a non-compliant 4.5mm balloon at moderate pressure. After post-dilatation, there was no evidence of distal embolization, brisk flow down the LAD, and similarly good flow down the diagonal. And in the spider view, you can see an excellent result to the LAD and something of a pinch at the origin of the diagonal, which in fact had been there before. But flow is preserved. At this point, it's worth noting that the patient's ECG had normalized and he was doing extremely well. So the patient received standard post-MI care and has done very well since.